and welcome to today's live stream. We're here with some exciting news today. We have our newest member of our team. You remember Lindsay Wilson, who is our IPV coordinator, and she's going to be introducing Karen Russell. But before we do that, I want to remind everyone to like, share, follow from wherever you are. If you want to leave a comment, you could do so from wherever you're watching, and we'll be sure to see it in real time. Or if you want to put a comment later, we will keep reviewing the comments to make sure that we answer everyone. So, welcome, Lindsay and Karen. Lindsay, can you start by telling us what is the IPV program?
Sure. Thank you, Rosalia. The IPV program is the Intimate Partner Violence Assistance Program. So we work with veterans, their partners, and VA staff who might be dealing with intimate partner violence. People might know it as domestic violence. So any relationship, health, and safety issues that come up. We are here to serve people who are either experiencing violence, or we also have services for people who are using violence. So I'm the coordinator in the Baltimore area and kind of the surrounding counties and clinics. And now Karen is up at Perry Point, covering Perry Point and the Eastern Shore. So Karen, I'll let you introduce yourself.
Well, I'm so glad to be here. Thank you so much for having me. I'm Karen Russell. I'm a licensed clinical social worker. I have been with the VA for 15 and a half years and have just joined the Baltimore healthcare system. And I'm going to be the Intimate Partner Violence Assistance Program coordinator here at Perry Point and the Eastern Shore counties. And so I'm really excited to join the team. I came on in May, and so it's been a wonderful summer being here, looking at this beautiful view from my office that has the water out there. And it's just been very welcoming, and I've just enjoyed the transition that I've made.
So where did you said you were with VA for 15 years. Where are you joining us from?
I worked for 15 and a half years at the Coatesville VA Medical Center up in Pennsylvania. So I started my career there, and I hope to finish my career here.
Well, welcome to Maryland. We're happy to have you on board. So, Lindsay and Karen, to remind our viewers as they're watching, what exactly can we do for veterans who are either experiencing interpartner violence or using violence in their relationships? I know we have a lot of programs that help both. So can you just give us like a little rundown of what exactly you do or that's out there that can help, and how veterans can actually get in contact with you if they are seeking assistance?
Absolutely. So for people experiencing violence, one of the things that we do at the VA is screening. So to help identify people, to help see what kind of violence they might be experiencing. So hopefully that's happening at your primary care or mental health or other appointments that you have. Once we identify people as experiencing intimate partner violence, we can help with things like connecting you to resources. That might be legal, it might be housing, it might be emergency shelter, it might be support groups or counseling. And, we can work with resources we have within the VA as well as in the community. We work a lot with local domestic violence agencies. We help with safety planning, so to help see what might be your safety concerns and how we can help make sure you're safe. And we also have a counseling intervention for people experiencing violence called RISE. It stands for Recovering from IPV through Strengths and Empowerment, which I always say is a little bit too long, so RISE. So that's something Karen and I both provide. For people who are using violence, we have a program called Strength at Home. So we have Strength at Home groups for veterans who might be using violence in their relationship or concerned they might do so. We also have Strength at Home for couples, which is a similar format, but for both members of the couple, maybe where there's a lot of arguing or conflict between both members. So lots of different services that we can offer or connect you to. To get in touch with us, there are a few different ways. You can get a referral from any of your providers that you see, whether it's primary care, mental health, anything else. They can refer you to us and we'll follow up with you. You can also contact us directly. Our numbers are listed on the national website. We can also provide them. I can tell you what our numbers are, and maybe Rosalia, we can also type them up.
Yeah, I could type them as you say. So is it one number to reach both of you, or I heard people could actually call the main number and ask for IVP. Is that correct?
I think they can, because our numbers are listed that you can be directed to us. But we each have our own cell phone, so you can reach us separately. So for the Baltimore area, so that's Baltimore and all the surrounding counties, so like Anne Arundel, Howard, Carroll, Baltimore County. You can reach me at 410-591-3004.
Okay. I think I got it down. It should appear. And Karen, when you said that you were going to be at Perry Point and the Eastern Shore, is that both of our community-based outpatient clinics that people would be able to call you?
Yep. So I'm housed in my office is at Perry Point, but that does include Pocomoke and Cambridge, and I'm actually going to go down to Pocomoke tomorrow and kind of meet everybody down there. My number is different from Lindsay's. My number is 443-525-0979. And as Lindsay mentioned, it's a government cell phone. So, kind of even when we're not in the office and like.
What are those last four numbers again? 525?
0979.
Okay. So these numbers are appearing on Facebook and Twitter and YouTube, where this is now airing. Is there anything that you want to let veterans who are either experiencing or using interpersonal, interpartner violence, you want them to know about coming in to get some help?
Well, I guess what I would like to say is sometimes even things that are happening in our relationships, we might not categorize as what most people think about violence. When people think about violence, they think about physical violence. And violence is just a very large realm. It includes psychological, it includes emotional, it includes sexual. And so, individuals who may be experiencing those types of violence, these programs are for them as well. And it could be the best place to get started in those, in those low, I don't want to say lower levels because it's not lower level, but in the less physical realms of violence to get connected and get the support. I think there's a lot of sometimes concerns about how people may view individuals who are in relationships that are unhealthy or that may be experiencing abuse. And there's no, we just want to be able to provide the help to people to help them feel stronger and empowered and be safe. And I would also like to extend outside of just even veterans and family members or people who are experiencing or using, if you know someone, if you have a friend who's a veteran and you're seeing this live stream, or someone who's in a relationship with a veteran, please reach out to us. We hope that we're here as a resource for people.
And I would like to add one more thing. Can you talk a little bit about one of the things that you didn't mention was financial abuse? And I know that is from talking to Lindsay many times that might be an issue. Can you talk about what that looks like so people can have an inkling and then also reach out if they feel, if that's an issue?
Sure. So financial abuse, I think one of the kind of main things that we see is that someone is restricted or doesn't have control over their funds, so maybe you are employed or you're getting money or getting VA benefits and your partner controls all of them, you don't have access to any of those funds. Or maybe you're not working and your partner does, and again, you don't have access to any funds. Maybe if you do request funds for something that you need, there's kind of, you have to do something maybe you're not comfortable with in exchange for that. So often there's a sort of really unequal or controlling relationship when it comes to money and finances, and that can be really limiting. So I think that's speaks to the importance of what Karen said. We want to try to intervene as early as possible. And I think the other thing I want to piggyback on from what Karen said is that, we're not here to judge or push you, right? We're here to be supportive, to provide you with information so that you can be empowered to make the best decision to seek safety for yourself. So I think sometimes people get concerned if they tell someone we're going to make them try to leave or call the police or something like that. And that's not our role here. It's really to provide resources, to offer support, and to help empower you.
All right. Well, thank you so much for introducing us to Karen and giving us a rundown on the program. So if any veterans are in Perry Point or Eastern Shore areas, please call Karen Russell if you need assistance. And those who are in the Baltimore metro area, Baltimore and its surrounding counties, please call Lindsay. Thank you so much for taking time with us today. Thank you, those who are watching. And if you want to give us a like or a star or a heart, please do. We appreciate all the love. Thank you so much.
Thank you for
Bye,
the
everyone.
Thank
Bye-bye.
you.